Dr. Frank, and then Mr. Botticelli. In your view, what are the most significant obstacles at the present time preventing more individuals with opioid use disorders from receiving the most effective treatments?
I think there are several factors. I think supply of treatment is certainly one important factor. Second one is stigma and the shame that comes from seeking treatment, the attitude of friends and neighbors. And then third, I think we're still working on our payment and coverage arrangements as we implement our parity legislation and as we move towards expanding our parity regulations.
Mr. Botticelli?
As you indicated, only about 20% of people who have a substance use disorder get care and treatment. And the factors that are often cited in those surveys, as Dr. Frank alluded to, is one, insurance status. And we know that either not having insurance or not having insurance that appropriately covers a spectrum of substance use disorder services is particularly challenging. As he also talked about, stigma plays a role. We know that in national data, and I hear it time and time again reflected in people's stories, that it keeps them from asking for help or delaying their care. And the third aspect, particularly as it relates to opioid use disorders, as we've been discussing here, is the really dramatic underutilization of medication-assisted therapies, not only in our treatment programs, but in our correctional facilities. We know we have many parts of the country that don't have a dedicated treatment program, and looking at, and I think particularly the Secretary's initiative focusing on increasing access to community health centers becomes particularly important. So we know that not having dedicated treatment in a local community is really, really important.
Would the two of you expand on that, on the role that you think medication-assisted therapy should play?
Mm-hmm. I'll start and
go ahead.
have Dr. Again, I think there's common agreement, and that all of the studies are really very crystal clear that by far people do better with opioid use disorders, do better on medication-assisted treatment when done in a high-quality way that includes other behavioral therapies and supports, bar none. So we know that not only do people do better, they don't die, they don't get infectious disease as it relates to it. And part of our efforts on the administration level, both at ONDCP in conjunction with HHS, is to ensure that people have adequate access. In addition to grants and other activities, we've also been strengthening our federal contracting language to ensure that those programs that get federal dollars that support treatment include the entire spectrum of FDA-approved medications for opioid use disorders.
Dr. Frank, you want to add to that?
The one point I would add to that is that it's not only important that we have people out there able to conduct medication-assisted treatment, but they have to do it in a way that is evidence-based. That is, having all the components in place: the counseling, the recovery supports, the patient monitoring. You need the whole package for it to work. But clearly, when you have that, it is the most effective treatment out there.
Thank you, Mr. Riley. I appreciate DA's willingness to work with the committee to ensure that veterinarians can travel with and administer pain medication to their animal patients. Athletic team physicians also have an inherently mobile practice. Yet, as was the case with the vets, the statute prohibits them from administering appropriate medication to their patients outside of their physical office. Will you commit to working with the committee and the Chairman Sessions on a responsible solution to this important issue?
Well, yes, sir, we will, and we are. This is a difficult balancing act in terms of making sure that the supply is there to legitimate patients given by legitimate caregivers, But we also want to make sure that the ability of diversion in these situations are as limited as much. So I look forward to working with the committee, and I know we already are, sir.
Thank you. I also appreciate DEA's efforts to combat the recent influx of incredibly dangerous synthetic drugs hitting communities across the country. Yet, I understand that due to no fault of your own, the criminals are a step or two ahead of you. Can you explain how Congressman Dent's bill would help in this regard?
Well, first of all, I want to say thank you to the leadership on this issue, because it really is an issue for us. As I look across the country today, what keeps me up at night is clearly the heroin issue, the opioid addiction issue, various organized crime groups, but second to that is the growth of synthetic drugs, primarily targeting our young people. I personally witnessed this where people have lost their lives. So from a cop's point of view, sir, and that's what I am, anything that could help us as a tool to make sure we can move quicker, we would welcome. And again, we're going to work with the committee to get it done.
Chair, thanks, gentlemen. I recognize the ranking member, Mr. Green, 5 minutes.